Hi, welcome back to HBW-TV. I'm your host, Zelnniezz. Today, I'm joined again by our very special guest, Ms. Zelnniezz Khoo, a consultant with over 20 years of experience. And today, we'll be talking about one of the issues that plague all of us, acne. So, Miss, please tell me, what is acne?
Acne is actually caused by too much of active sebums on our face.
Okay.
Yeah.
Does that mean that people with dry skin won't get acne?
Yeah, dry skin will never get acne because they don't have so much of oily glands inside underneath their skin.
Okay. So people use the term acne and pimples interchangeably. Is there actually a difference between
Yes,
these two?
acne usually come with pulses, big pulses, and they feel irritating, and sometimes they feel pain as well. And pimples is actually causes by sometimes the face is not clean enough, congested skin, and stress.
So what causes acne then?
Acne is caused by over excess oil glands under the face, and sometimes it's because of hormonal as well. It will also cause acne.
Okay. What are the clear identifying markers between acne and pimples, and which is more severe?
Acne, you see a very big one, like a big bump, all right. And usually, when we press it on the acne, it will cause a bit pain, all right. And definitely, you will see that a whitehead on top is like a pus. Pimples usually is very small, and it will actually scatter quite around on certain areas.
Okay. So you talked about whiteheads. We also hear the term blackheads a lot.
Yeah.
What is the difference between these two?
Usually, we have whiteheads at the beginning of the stage, all right. During after that, when you get oxidized, if you did not extract out the whitehead, when it get deoxidized, it become a blackheads.
Okay.
Yeah.
So
Once you get the blackheads, when we extract it out, it feel like it's a very hard. The whitehead one is like just the oil sebums that's come out. It's very oily type.
So we hear a lot of people say, don't pick your face. Is that good advice?
Yeah, it's good advice. I would always stress to my patients that don't touch your face. Right? Because our hands is very dirty. We use our hand to pick up money, open the door, open a car door where it's actually collecting dust, and our face used to have a lot of oils coming up. If we touch our face, this is where the dust actually get to our skin and actually block our pores. This is where you have congested skin and pimples will come up.
Very true, very true. So if let's say I have this very annoying pimple or acne and I clean my hands thoroughly, is it recommended that I pop it?
Pop it yourself.
Can I pop it?
If you doesn't know the proper way to pop it up, you will cause you scars.
Oh.
Yeah, scars usually last you about 9 months to get rid of your scars, because usually scars, if you have fresh scar, is red color. If you did not apply proper sunblock, you don't take care of it, it becomes black. We call it PIH scar. It's post-inflammatory, so it will turn like black color. That will take you about 9 months. Sometimes certain people will be to a year to get that scars out from your face.
So it seems to be that there's a very big repercussion if you don't pop your pimples correctly.
Yeah,
then.
correct.
So what is the proper way to pop a pimple?
If the patients come in with a pus on the pimples on the forehead or anywhere in the face, usually we actually clean the face first and sterilize the area, and we use a very tiny needle to make a puncture of the hole and use it to extract it out.
Okay.
We don't force it to come out because you actually injured our dermis layer of our skin. That's where the injuries come in and you cause you a scars.
So do you recommend that people with this knowledge pop their own pimples at home?
Of course, I don't recommend it because you don't have proper cleaning and you don't sterilize. After the pimples come out, you don't sterilize it. It will even cause you more inflammatory.
Okay, that's very true. So if I were to want to come in to have a pimple pop, when do I know when it's ready to be popped?
Alright, usually if a patient come in, if we have acne on the face and we see that it's inflamed, alright, there's no pus, usually I don't do it for them. I just wait for them, get the pus to come up, then only we extract it out. Because without seeing the pus, that means a lot of people in a layman term, they say the pimples has not ripe yet, alright? So it's actually not up to that note for us to extract out. So usually I would not extract for this type of patients.
Okay, I see. What about not popping the pimple and letting it subside on its own? What do you have to say about that?
Usually after you have this out acne, it won't subside by its own if you did not take it out, because I'm sure there's a pus inside. So usually we advise the patients to come in to extract it out, or they can use topical applications. Usually we will advise them to get a gel in the pharmacy or wherever, but it's not advisable to get ingredients which is benzoyl peroxide, because benzoyl will actually dry up the surface of the pimples, and when it's dry up, the surface is dry and you cannot get the pimples out already. So forever it will stay there, the surface is dry, the pimples is actually underneath, the pus is underneath, and you forever, for a year, you can feel that your face, the bump is still there. Alright. Usually we want advise them to get a gel, a pimples gel, where actually you apply it and it will actually absorb the gel, the pus out, which is like those tea tree, you know, those salicylic acids, you know, the HA products. Yeah.
We look more to hearing about that in our treatment section. So, talking about acne, a lot of teenagers experience what they like to call chronic acne. Could you tell us what is the difference between chronic acne and acne then?
Chronic acne, that means these patients comes in with the whole face full of acne, and these are patients we usually don't use manually to treat them. That means, what I mean by manually is that we don't use extraction to treat them. We will actually advise them to see a dermatologist where they need to have oral medications.
Okay.
Alright, after oral medication, actually that type of chronic acne will actually subside.
So in Malaysia, because of how hot and humid our weather is, and most of us have oily or combination skin, do you think that Malaysians are more prone to getting pimples and acne?
Everybody will get acne, alright? It's because that why they get acne is that they don't do a proper cleaning, alright? For example, certain ladies, they will apply those foundations or BB cream, SC cream. You have to make sure that it really cleans well, alright? You have to makeup remover, cleanse it, double cleanse it, you know, then you will have proper cleansing, make sure that it really clean on your face, then you don't have pimples. Even though the small students, they don't apply this, but they tend to have very oily skin, alright? If they just wash your face with water, all this oil on your face will never remove from their skin. So you will actually accumulating of oil and actually congested their pores, and that's where they form all this chronic acne.
I see. So do you think students or the youth market are more prone to getting pimples and acne?
Not necessary. Some students, some of my patients here who are as young as standard 3, they are 9 years old, they do have pimples, but some they don't. So usually depends on the skin, because certain people, they're born in a different dry skin or oily skin. Usually dry students, they don't have pimples. But if usually from our experience, if they don't have pimples during their teenage year, they will have pimples during their age at the 30 and above. 35, 40. We call it adult acne or a cosmetic acne. This is because of hormonal changes where they have acne, or sometimes they're using a wrong products, they will have pimples as well.
Okay. So you mentioned deep cleansing as quite an important way to prevent acne. Could you tell us more about deep cleansing and how that would incorporate to a daily person's routine?
Deep cleansing is that, you know, every day when after they reach, before they go back to sleep, you know, they need to make sure that it's makeup remover, cleansing mirror, and then a cleansing gel. This is a basic step for them.
Okay.
We call it a double cleansing.
Okay.
Alright. At the same time, they also can do weekly scrub. Other than scrubbing is only a superficial scrubbing. We also advise the patient they can also come to our clinic to do a laser. We actually help them to remove the horny layer of the dead cells of the skin. We are using carbon peels. Alright. After this, they will go back and they feel that their skin is very clean and don't have so much of oil. And apply of product is also better penetrations because the skin is clean, pores is clean, and they apply the product is better absorption.
That's wonderful. Thank you so much. I really do look forward to hearing you tell me more about the treatments of acne in our next episode. Thank you very much for your time.
Yeah.